Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and faculty of orthopedics. Well, today it's a special day, so I thought I'll share some information with all of you. Today is the 3rd of June. 3rd of June is World Clubfoot Day. Why World Clubfoot Day? Because a person who is a pioneer in the field of clubfoot, which is CTEV, Dr. Ignacio Ponseti, a professor of Iowa University of United States of America, was born on this date. So today is Dr. Ponseti's birthday. God bless his soul wherever he is. He has given to this entire world something which we all are very proud of, and I'm sure you can see that is something which is called as Ponseti technique. So it was developed by Dr. Ignacio Ponseti, say about 5 to 6 decades ago. Dr. Ponseti realized the problem of clubfoot, which is CTEV. It's not that he was the first person to do that. Of course, there was a policy before him as well, but he corrected all the mistakes and he came up with this thought because you need to understand that more than 1 lakh children, they are born worldwide with this problem. So clubfoot is basically a pathology of leg, ankle, and foot complex, which is characterized by a few deformities, which are cavus, adduction, inversion, which is combined together to be called as varus, followed by equinus. Now, Dr. Ignacio Ponseti gave Ponseti's technique, which is the ideal treatment of choice from 0 to 1 year of age. See, right from a newborn till the baby is an infant, celebrates first happy birthday. This man gave the technique. So, happy birthday, Dr. Ponseti. You gave this technique, which we follow still till today. So, what he says that the crux of the technique is that in a newborn, the foot is a bag of a wet clay. एक गीली मिट्टी की तरह है जिसको आप जैसे चाहें, you can mold it. It's malleable. It is ductile. Then the technique works amazingly in newborn, even when you have a delayed treatment. Third, he said, no force is needed. That was something which he corrected in one of the previous techniques which was given. He said, no harshness, no force, be gentle, be gradual. The technique basically emphasizes on two words: manipulation and casting. So you need to manipulate the deformity first, then in order to make sure that whatever deformity you have manipulated, it stays in the correct technique, that you have to make sure by application of a cast. This is a very important keyword in Ponseti technique, that we should go for a sequential manipulation rather than simultaneous manipulation, because people had a feeling that you should correct all the deformities together. No, he said we will go one by one. Okay. One more thing he said, that please expect that equinus is a very notorious deformity. So be ready to perform tendo-Achilles lengthening, that is called TAL, even if it is required, we have to do that. And then he said till about 3 to 4 years of age, we have to have a splintage which is to be applied. And of course, the crux was poor compliance is not acceptable as far as the parents are concerned. So Ponseti technique, I'll just share the keywords with all of you. The keywords are very simple, that the principal primary bony pathology is talus. The principal primary joint pathology is talonavicular joint. The principal primary tendon pathologies are tendo-Achilles, responsible for equinus, tibialis posterior, which is responsible for varus. Dr. Ponseti's technique, which is manipulation and casting, is based upon gentle manipulation followed by casting. Now, as far as manipulation is concerned, the first thing he said that we will go for sequential manipulation. Cavus is the first deformity to be corrected, followed by varus, followed by equinus. So first one to be corrected, cavus. The last one to be corrected, equinus. Difficult one is equinus. Most notorious, equinus. To reoccur, equinus. Expect endo-Achilles lengthening for equinus. Second thing, he said that manipulation will be done mainly by the doctor. Of course, you can educate the mother, but there is no active role. Then he said that manipulation should be started as soon as possible after birth, in which the first deformity to be corrected in couple of first few weeks is cavus. As I told you, followed by varus. As I told you, followed by the last thing to be done is equinus. The fulcrum of manipulation is always the head of talus, because that is where the principal pathogenesis lies in. The fulcrum is head of talus, but the aim is talonavicular joint reduction, because the moment you reduce a talonavicular joint, the overcontracted tendons will start settling in and you will be able to correct the deformity. Now, you have corrected the deformity. Congratulations, because Ponseti technique has a success ratio of more than 95%. But once you have done that, you can see the three photographs here, how we have corrected the deformity. But once you have corrected the deformity, then it is your job to make sure that your deformity is corrected, remains corrected. How do we do that? good compliance by parents, in which you should have CTV shoes in the day. I'm sure you can see Dennis Brown splint in the night. Last point I want to cover here: CTV shoes have got three properties. Number one, they should not have a heel to prevent equinus. They should not have a curved inner border to prevent. They should have a straight inner border to prevent adduction. They should have an outer shoe race to prevent inversion. So not only you're supposed to remember three properties of shoes, but you're supposed to remember what are they for. So no heel to prevent equinus, straight inner border to prevent adduction, outer shoe race to prevent inversion. Well, I hope that you got a quick recap of Ponseti's technique for clubfoot and all, because of, today is 3rd of June. I repeat again, well, again, happy birthday, sir, wherever you are right now. I'm sure you are blessing the entire pediatric orthopedic community with your technique, and I think that makes you immortal, sir. Very, very happy birthday. World Clubfoot June, 3rd of June. World Clubfoot Day, 3rd of June. I wish you guys all the best. Thank you.